Good morning, and thank you so much. My name is Kristopher Gillespie, faculty here at Horry Georgetown Technical College in Myrtle Beach. And so I'm very excited to share with you a little bit of details about my opportunity and involvement with the Faculty Academy for Teaching in Non-Traditional Fields. So first off, I'd just like to, give a good shout out to the entire team. It definitely was not myself alone that made this a success. And so Lorraine Ardrich, our department chair, as well as Ann Daniels, who's one of our VPs here, and of course Emily was great with resources and technology and helping particularly us to do this from remote locations. So I very much appreciated that. So within our project or process with the program, our initial data or analysis showed some disproportionate admission rates of males into the nursing program here at the college, and also some of our related fields as well. So after a deep dive, one of the really interesting things that we found out about this was that once we deep dove into this and actually did a firm survey, we realized that as a whole, we have a very disproportionate admission rate of males as it compares with our demographic in this area. So that was really interesting to find out. So initially, our hypothesis was that males were less likely to enroll in programs, nursing programs, because of the stigmas that are associated with the field itself. After we conducted that initial survey and in person, one of the challenges that we saw later on with this was that we were conducting this with folks of my generation and even above my generation. And so our experience, 20 years ago in the field is a little unrepresentative of how people might experience the nursing programs today. So our initial thought process was that, yeah, there's probably some stigmas and men don't want to be nurses because it's associated with a female role. But after the final and official survey, the results showed that those stigmas that we thought were present were significantly less important for people who were enrolling in the programs. And I'm going to share for you a little bit of that data. So this is the SWOT analysis. The number one driver after we looked at the survey, and I'll show you some of that data as well. The number one driver was interest, followed by number two, which was salary. But what we did find out through that survey is that not only do we have a disproportionate admission into the nursing program here, we have a disproportionate admission period in the entire college. And so looking at that to broaden our scope and our focus of how we might be able to provide a positive impact for the community was a big piece of this. Our strategy changed considerably after the survey. We switched gears to a more global outreach of males and students with particular focuses in healthcare programs. And when considering, that yes, we have slightly lower rate of male admissions, but comprise total, 33% of our entire student body is male. And so that's a big disproportionate number when you look at demographically. Females comprise about 51 to 52% of our population. So as far as the participation in the academy itself, we started with participation to assess the attitudes of the population towards individuals in non-traditional roles. We crafted a survey, we utilized SurveyMonkey, and then we analyzed that data. So I'm going to share with you a little bit about this. This was our activity of what we thought going into it. So social stigmas of males in nursing, communication differences can cause some difficulty, and then a lack of male role models. These were the three things that we were hypothesizing that were preventing admission into the programs. This is that directly from the survey. So you can see that your number one driver was interest, followed by salary. Those are the actual survey results. And then, of course, we asked those participants what gender that they related certain fields to. And to my surprise, nursing, that first one, there was 52% said both, and then a smaller percentage said female. And when you look at the status when you get down like automotive or welding, it's very, very lopsided. So that was interesting data to see. Okay. So with the report, of course, we use SurveyMonkey. We learned that often our preconceived notions about metrics can cloud our vision on what to focus in on. Early on, I think what we would have liked to done a little bit different is getting that survey out in a more timely fashion. We were a little late to the game getting that developed with our marketing team and who to get that out to. But yet, I think early on, and having less of our emotional and nostalgic ideas put into the program and just get the data. Let's get the data and look at that and analyze it. Okay. So going forward, we are still focused on male enrollment, but it's more of a broad spectrum now. Our first implementation strategy with college leadership is going to be to focus on very specific populations. In this case, we're looking at our veterans. We're going to emphasize programs for that population, and particularly those with medical backgrounds. So we're also working with, we're going to be working with our partners outside of the organization to see if we can get things that'll work well for them, giving them credits for what they have learned officially outside of HGTC. As we move forward, we're going to be looking at more programs that might do this and include those areas that that are less represented. And we're going to continue to share that data and collected metrics in the multiple formats. And overall, as a learning process, I think that we've learned an extreme amount about, particularly I have. Some people might know some of this process, but it's been extremely helpful in identifying how we can guide our intentions and our programs based on rational metrics and data. So that's been really fun for me to learn. And Megan, I really appreciate everything you did for us as well. It was great to participate in this program. And thank you very much.